you know, it's really good for us to wonder, what is it about this technique? This really simple, effortless technique, you do it twice a day for 20 minutes, such a gentle technique that can have such a profound effect. And the answer comes in a single word, and that word is stress. Because stress is everywhere. I see it in my patients, in myself. I see it on the evening news, hurricanes, tornadoes, poverty, unemployment, illnesses, wars. We see it every day. We'll see it in the combat-related PTSD that you're going to be hearing down the line. And it's a really terrible thing, the stress that goes on, because really the stress response is geared to be a short, targeted response to a specific issue. It's not supposed to go on, and it can be really devastating if it does. The great scientist who described first the harmful effects of stress, Selye, said, it's not stress that kills us, it's our reaction and response to it. And indeed, it does kill. And as we know, cardiovascular disease is one of the biggest killers. It kills 1 in 3 people. And I would actually like to show you just a few slides which illustrates the direct connection between TM, stress, illness, and death. Over here, we have several stress management techniques and their effects on blood pressure. Here we have TM, which has the largest effect. This is called a meta-analysis, where you pool the results of many different studies. And look here, muscle relaxation, biofeedback, significantly less reduction in blood pressure. And this combination treatment actually makes blood pressure worse. So when somebody says they're going to get a stress management technique, you've got to ask them, which one are you going to get? Because it does really make a difference. There's a specificity here. And of course, we know that high blood pressure is, as we call it, the silent killer. Next slide, please. And how does it kill? Here we've got a cartoon of 2 arteries. This one is nice and open with the clean linings of the artery, and this one you see is being infiltrated with cholesterol and inflammatory processes, and you see it's getting blocked off. So whatever the organ is at the other side of this artery, it's in good shape over there, but it's in trouble over there. So if this is your heart at the other end of that artery, you're a candidate for a heart attack. Or if it's your brain, you're a candidate for a stroke. Next slide, please. And this, in fact, does play out, because what these ingenious researchers did, this is the brilliant work of Robert Schneider and his collaborators, is they followed up people who years before had been in this random controlled study of TM for blood pressure. And what they found when they looked at the death records in the counties where these people had been studied was a 25% reduction in mortality over the 7 or 8 year follow-up period in the group that had done the TM 7 or 8 years before. And remember, they don't even know if these people continued to meditate or not. But so profound was the effect that over the course of years, it played out in the form of prolonged longevity. To their credit, they then went and did a prospective replication where they randomized to TM versus a health education control. And what you see, this is the rates of death, heart attack, and stroke in a health education group versus a TM group. And over 5 years, there was almost a 50% risk reduction in these hard endpoints, meaning fewer events and later events occurred. So what you're seeing here is a technique so gentle, so subtle, so effortless, but so powerful that day after day, year after year, it plays out in terms of major cardiovascular illness and longevity. And if it's doing that at the physical level, it's not difficult to imagine that it's doing that at the psychological level as well. Decreasing anxiety, decreasing stress, increasing joy. So I'll leave you all with that thought. Thank you.